This is Health UnaBASHed, broadcasting live on Healthcare Now Radio. Health UnaBASHed is a conversational platform where healthcare meets innovation. We engage top industry talent and dive into the heart of health and wellness from vision to business model to bring you the latest developments in health tech to promising AI applications, policy, and ultimately impact on the public's health and well-being. I'm Gregg Masters, co-host and executive producer, and am joined by the digital health aficionado himself, author, editor, global thought leader, and in his executive capacity, steward servant Gil Bashe. Together, we're on a mission to bring you the people, the ideas, and the companies that are not just talking the talk, but walking the talk. On today's menu, we are in the company of John Whyte, MD, MPH, a physician, author, and policy expert with a unique combination of government and private sector work that provides him with an exceptional perspective on wellness, clinical trials, information technology, innovation, and healthcare services. He is currently the Chief Medical Officer at WebMD. So with no further delay, Gil, the mic is yours.
Gregg, a gracious introduction. That's so appreciated. And I always enjoy our time together as we kick off these programs.
As do I.
Really? I hope so.
Yes.
Good. Why not? I'm really happy to have you back, Dr. John Whyte.
Well, thank you.
This is one of those rare occasions where I entice someone back onto the program because I just don't feel we really had enough time last time to wrap things up in a tidy bow as we should.
I don't know if you enticed me. You basically asked me.
That's
whenever.
But wasn't it the gifts? Wasn't it the constant gifts that arrived at your doorstep?
Whenever I asked by Gil Bashe to do something, you're one of the people that I'm always ready to clear the calendar for.
I'm honored. Whenever I'm with you, I feel as if I feel healthier. I don't have to exercise or watch my diet.
Oh, well, that's not true. We all have to do that.
I need a hefty dose of Dr. John Whyte, and I just feel better automatically. So for those who are not familiar with Dr. John Whyte, you're in for a treat. Dr. Whyte is the author of 5 books, many very important. He's written books about cancer, diabetes, heart disease, diet, and even middle age, way back when. Some of us really appreciate that book more than ever before. John is the Chief Medical Officer of WebMD, the most respected and trusted source in health information today. And I think it's a very important baseline source because we're going through a great period of misinformation and disinformation in the health system. I'll differentiate between the two. Misinformation is sometimes people make mistakes and they recognize it and they jump back into the fore and they correct themselves. They say, that's not right. It's this. I'm sorry. Disinformation is when people intentionally share incorrect information. And they want to really reinforce that information for some gain or another. I don't know what it is. And John, you've really been on the forefront of talking about the importance of accuracy and information. It's been, for those of you who are not familiar with your past career, you've been in with FDA. You're an active treating physician. I think you try to get at least one day a week where you're in the clinic seeing patients. I can only imagine when you move that white curtain aside and they realize they're about to be treated by Dr. John Whyte. I don't know.
That's not how it goes, Gil. I saw patients earlier today, actually.
Really?
They just want to know why they have a sore throat, why their blood pressure isn't well managed. They get to the point pretty quickly, to be honest.
They don't say something like, hey, is this on television right now? They don't ask you?
No, very rarely someone will say something about an episode. But for the most part, it's pretty much business of getting things done.
I'm glad that you're in the business of medicine and the business of leadership of our health system. I just want to say that, and I think a lot of our listeners would probably nod their heads in agreement, that there's a lot of mistrust or disbelief in our public health officials right now. A lot of that, I think, is not appropriate. I think our public health professionals are in the front lines. They're making health decisions based on the information they know. And unfortunately, in fast-moving conditions like pandemics, we're getting more and more data, and things are changing by the week. And so they have to update themselves. But I think doctors sometimes have a hard time saying, gee, that wasn't correct. This is the new information. You've kind of been a beacon of stability in terms of explaining information to consumers. You've been on television, countless TV stations, sometimes daily, particularly during the height of COVID. But even now, you continue to be obviously in the forefront of media. I wanted to ask you, John, if you don't mind, knowing that you're invited on is kind of in the shadow of controversy, and you're trying to be a neutral, calm, informative, fact-based source of information. Do you mind sharing with us what tension you might feel you're under when you step on? They say you're on, and they point at you, and you're on camera, and you now have to sort of kind of correct the narrative.
Gil, I get this question really every few months, sometimes by another doctor, in terms of like, how do you communicate information, or patients want to know. So the first thing I always tell people, I stay in my lane. I talk about what I know, what I'm experienced in, and what I'm comfortable with. Sometimes when you're a doctor, people in media or even the public think you know about every topic. And you don't. My field is internal medicine. I just treat adults. I don't talk about pediatric issues. And one time a few years ago, I was on a live TV show, and I was talking on issues of heart disease. And another guest was supposed to come in and talk about issues of pediatrics in terms of ADHD. I don't do that in kids. And they asked me if I could fill in for it. And I said no, because that's not my area of expertise. So the first thing I do is I stay in my lane of what I know. And then the other thing I've learned over the years, Gil, is I recognize you only have a couple of minutes to grab people's attention. Sometimes it might just be a few seconds. So in the past, you try to get all this information because you think, I got to tell them everything. I got to parse all my words so carefully. And then you realize they're not paying attention, or they've tuned out, or they literally have changed the channel. And now I try to think, like, how am I going to do that? As you know, in the advertising world and elsewhere, that elevator pitch, I might only have, 30 seconds or a minute. How am I going to get you interested in this topic? And what I learned at Discovery Channel is sometimes it's the power of storytelling. Reel them in with an interesting story and have these little crumbs of information along the way. You got to make information entertaining as well as educational.
I think this is a little more critical of a conversation than you can imagine, because I think one of the reasons why the CDC stumbled so much, and they acknowledge that, of course, during the COVID era, is they forgot exactly what you have said right now, which is it is about storytelling. It is about staying in your lane. And something else you said that I think physicians really are not trained enough to do, which is, I don't know. I don't do that. I think that.
And it's also the parlance that we use, the language. And that was an issue during the public health crisis. Some self-inflicted wounds. We use words that people don't understand or don't know, or we talk down to them. There was a great article recently in New York Times and some other places about this concept of dead butt syndrome, which basically means, you're sitting on your butt all day and then you're actually losing muscle function, right? But the real name of it is gluteus amnesia, right? So if you start using that word and talking about your gluteus, people don't even know what that means. Even if you say your glutes, is that the hamstrings, is that the thighs? But it's the butt.
sort of like headline this episode is "Forget About Bird Flu."
There
Dr.
you go.
John Whyte
That's right.
warns
Or
America.
monkeypox. We were calling it monkeypox. I once had a patient came in and said to me, I want to get that vaccine for monkeys. And I'm like, okay, let's dial it back. But my point is, it's about the language that public health officials sometimes use. And I was like that. I wanted to parse everything so carefully. Or you use words so often around other people that you think everyone knows it and they don't. And you don't have experts like you are in communications and marketing that are reviewing these materials to realize you have to get people's attention and use language they understand.
Why is it that in medical schools today, we don't appreciate that communication as part of the care? It's part of the cure. And we emphasize so much on memorization of physiology and organic chemistry, and not enough about training people on use of words, communication, empathy, listening skills. By the way, I saw a great study recently that showed that doctors who sit down in front of their patients actually create a better patient experience for their patients. It cited, I feel closer to my doctor. The outcomes are actually, the data showed, are actually the same as the doctor who's standing, because they're really communicating, which is, I don't have a lot of time to spend with you, so I'll stand so I can head for the door. The doctor who sits down, who spends the same amount of time in the room, is seen as more connected and personal. Do you, to the best of your knowledge, are they treating any John Whyte techniques at Harvard Medical School?
Well, some are, but I'm going to tell you why, Gil. Doctors aren't in general good communicators. And if you go find 10 doctor friends of yours and you ask them, are you a good communicator? 9, 10 out of 10 will say they are. And
because they can't say no.
And 8 of them are not. Because everybody thinks they're a good communicator. How can it be so hard? You do it every day. And medical school and training is all about the biologic sciences. And empathy, teaching communication, that's the social sciences, right? And that's still somewhat looked down upon in medical training. The biologic, hardcore clinical faculty are up here in terms of research. And those people that are interested in the humanistic aspects of medicine aren't going to become dean, aren't going to become chair.
A course where they teach medical students of how to put the stethoscope around their neck and sort of like position it just so that
it all depends on your specialty too. I don't even think orthopedics might have one. Orthopedics listening. But Gil, they're not teaching these skills because people aren't asking for them. They don't think they need it. And what I've learned over the years is, you have to learn communication skills. I learned the talk back method in terms of, they're telling me back, or teach back method in terms of they're repeating what I just told them, because I had learned that in a course, because I went through that effort to learn more communication skills. And the training period is so intense in terms of everyone has something they want to cover in the curriculum. So it's a real battle, but it's also, medicine and other professions, they're lifelong learning. You have to recognize when you're not good. And I'll tell you, even when I was at Discovery Channel, whenever you want someone to speak on some important health topic, if you go ask the academic centers, who do they pick? They pick the most senior person, right? The chair of the department, who's typically still a white male that, doesn't see patients often anymore. And that person's the expert that's going to give advice to the public. And what we learned is we need to have communicators that look like the people that they're serving, that use the language of the people that they're trying to communicate with, and then are assessing how they did. We need that component too, Gil, and we don't do it enough.
Just dropping in, you're right on time for Health Unabashed on Healthcare Now Radio. Today, we're chatting with physician, author, and health policy expert John Whyte, MD, MPH, a thought leader and role model for many with an exceptional perspective on wellness, clinical trials, innovation, technology, and healthcare services. Stay tuned for the Rest of the story.
Interesting. I was privileged to moderate a session for patient advocates in Philadelphia at the College of Medicine last week, and three outstanding physicians were in a panel. A doctor who is Hispanic, she's Cuban by background, and two Black African American physicians of note, and they talked about the fact that coming into a room during COVID, one of them said they're completely masked, of course, in a hazmat suit, but the patient could see through a bit of the mask and said, "Are you Black?" And the physician said, "Yes." She said, the person gave a sigh of relief and said, sort of like, "Thank God." And when I look at the percentage of medical students who are of color, it's relatively small to the population. I mean,
especially in terms of African American men, men of color. They're not much better than where we were 30, 40, 50 years ago. We've made progress on women. 2% of the medical school classes, if not 51%, are women. So we've made a lot of progress, but they're still primarily Caucasian women. Yeah. So we have a way to go.
The social determinants of health still reign. I wanted to sort of plumb this because you're so on point and you're so good at this. I don't know if you said you study this method, but I think some of it is intuitive. And I also think, having spent time with you before, you have really a bolus dose of empathy for people when you're with them, where doctors are sort of often just going through their day. It's procedural, where for you it's a very human function, and that's why you're chief medical officer of WebMD, because WebMD is serving the public. It's almost, as I said, our public information, public health infrastructure of this nation, and you're there at the medical helm of all this. What I wanted to ask you, though, is, knowing all that all we've experienced throughout this COVID period, and the ripple effect of COVID now on monkeypox or bird flu or whatever, we know that communication is an essential function, and yet time and time again, we stumble and we fall. I'd love your perspective, both you, the physician, you, the chief medical officer of WebMD, and actually you as I almost think that you're a observer of society in terms of its health.
And luckily we changed the term, by the way, to MPOX. So at least they learned something.
Yes, that's true.
But Gil, what I would say is, in some ways, I'm even more concerned today about misinformation, disinformation, than I was a few years ago. In many ways, everyone feels they're their own expert when it comes to health. Now, you are the expert of your own body, and I tell patients that, but there's a reason why we go to medical school. There's a reason why we learn about different conditions. And search is changing. So remember, there's a billion Google searches, a billion every day on health. And where are people getting the information? I'm proud to say that every piece of our content is reviewed by a board certified expert. We show who that expert is, you hyperlink to it, and we put the date that it was last reviewed. A lot of sites don't do that. So where are they getting that information? A lot of health information is done on TikTok and YouTube. And how do you know what that person's expertise is? How do you know they're not being paid by someone in industry? They're supposed to disclose it, but it's not always disclosed. I wish in some ways people would view health information the same way that they search and think about financial information. And what I mean by that is, you wouldn't just take anything you read online by an influence to say, do this about crypto or invest in this stock. What would you do? You'd look and see, who's this person that's giving me this information? What's their credentials? Let me verify what they say and see if I can find it somewhere else. Let me talk to someone who I value. And in healthcare, Gil, and I've seen it with patients, they figure, I'll try it. And what's the harm? And sometimes there is harm. And when it comes to their bodies, the most important thing and their health is kind of like, I'll give it a try. And their finances, they're like, oh no, that's too serious. Like I can't lose money, but they can lose health. And that's a big concern. And the other thing I'd add, Gil, is we have to address generative AI. Where is that information coming from? Right? Because we're used to, you and I, searching online, looking around,
and verifying
WebMD and other things. With voice search, say, not even ChatGPT, with voice search, I'm just asking Alexa. I'm just asking Siri. They're just giving me information and I'm accepting it. But how do I know the validity?
Misinformation becomes embedded in the system as the new.
That's a real concern I have.
I wanted to ask you a key question. In my time, patient advocacy organizations were the home for patients seeking information to go and get clinically validated information. And I saw this morning, I was privileged to see a survey of 4,000 patients with chronic conditions, and broken up by about 20 plus chronic disease states. So I could see fibromyalgia or different things, you name it, EDS, you name it, and their opinions. And what I'm seeing is a trend that fewer and fewer patients are now leaning toward patient advocacy organizations, which may be vetting information, have scientific advisory boards, and more are just, to your point, it's either voice search or OpenAI search, which invites us to hallucinations. So, could you be prescriptive for a moment and guide us? There are a lot of major advocacy organizations out there that I sense have focused more on fundraising than they have on content and communication.
Right.
Is that just my impression, or do you see that as well?
No, I see it as well. And I will say to our listeners, I met Gil through his advocacy efforts on various disease states. And he met with me at WebMD, and we've clicked ever since because I respected what you're doing about advocacy of patients with certain health conditions. I think the issue is, in some ways, some of the patient advocacy groups have been like the physician groups, right? Sometimes they take their members for granted. They're not necessarily giving them the information that they need. They're not doing it in a way how people like to consume information. Sometimes that's because of limited resources that these organizations have. But some people like to learn by reading the information, right? They want to read an article. Other people want to listen to it as a podcast, maybe on their way to work. Other people want an infographic. Our newsletters are still very popular. A lot of people want a newsletter. Others want a short video. You have to be able to do that in all those platforms, recognizing different people like to consume information different ways. And the other thing that people forget is you got to keep giving them information. You got to get them to keep coming back. You're not going to teach them everything, all at once. And then we have to empower people to understand and to learn how to look at information on health with a critical eye. And we have to be cautious in the sense, too often we talk down to patients, right? Oh, you don't know, or you can't judge, or you can't do this or that. But we really have to help them think through some skills, just as they would learn financial skills or other elements. And it's funny is because, I used to ask this question at meetings when I'd say to people, how many people are willing to rewire their kitchen? And there's always one person there that's like an electrician, but most people will be like, no, because that's dangerous. It's electricity. But when I say, how many of you are willing to, try some new diet that, you saw on YouTube? They're all like, oh, I'll try it. And you think when it comes to your health, you're willing to try these things, and you're not necessarily thinking the same way. Because a person with 1 million followers seems to have done well, but we don't know all that backstory. So we have to help folks figure out how they can judge that information and give them the skill set, recognizing that how people search is very different today than it was even just a couple of years ago. And it's going to continue to iterate. And I think voice search is going to be one of the biggest players.
How about
and that includes generative AI.
What do you think about large language models then?
Absolutely. And the big issue is going to be, what are the training sets that they use to learn this information? And there's not always transparency. Sometimes it's because it's their proprietary information. They don't want to share it, but we have to ask those questions. We first started to realize this in terms of the dermatology space, where most of the textbooks are Caucasian people, and psoriasis, eczema, other conditions can present differently in people of color. But if you haven't trained that data set, these models on a diverse data set, you're going to continue to have those biases persist.
Now, look, the reality is you are so sensitized to this. Part of it is the role you play at WebMD, the values of WebMD, to some extent, even the brand promise of WebMD as the most trusted source of health information in this country.
But we say that better information is going to lead to better health. And that's really the key. If you have wrong information, you're potentially going to do harm. We all have seen people that have tried different things for cancer that have been unproven and have had bad outcomes. That doesn't mean that everyone has to have chemotherapy and all these other options, but you should really know what's happening. And that's not always the case. And sometimes people are just trying to, make a dollar and giving misinformation.
That's most certainly. You've written some great books about preventing disease. In the seconds we have left, I just want to get your takeaway, maybe a message to America, why interventional medicine, primary care, internal medicine is so critical to this nation's future.
Yeah. And you only give me like 30 seconds to do all that. But, the quick summary will be, at the end of the day, all we have is our health. We learned that during the pandemic. A sensitivity is our most important commodity. And people have to understand that genetics probably only causes about 20 to 30% of health conditions. So what we need to do is to control what we can control. And there's many aspects of lifestyle that can prevent disease, or at least delay disease. And that's a fundamental mindset for people.
Perfectly said. We've been listening to Dr. John Whyte, WebMD, the Chief Medical Officer of a great institution. He's a great physician. He's a great human being. He's a person that we should look to for credible, authentic information, accurate information that allow us to make informed decisions. John, as always, what a privilege to have you on the program.
Thank you.
And that, dear listeners, is the last note for today's melody. A huge thanks to our worldwide audience for tuning in. And a tip of the hat to our special guest, John Whyte, MD, MPH, physician, author, and policy expert with an exceptional perspective on wellness, clinical trials, information technology, innovation, and healthcare services. Do follow Dr. Whyte's work at WebMD via www.webmd.com or on Twitter via @DrJohnWhyte. Health Unabashed streams live 3 times a day on Healthcare Now Radio, Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern, 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. Stay social with Gil and me on Twitter via Gil_Bashe, and that's BASHE, and Gregg Masters MPH, and that is Gregg with 2 G's. Don't forget to give your tweet some zing with our hashtag HealthUnabashed. Until we meet again, pursue your passion for better health and with no apologies.